But I'd also like to thank the Honourable Member for Glasgow North for organising this important debate. It's sometimes argued the public can only focus on one crisis at a time. I don't share that cynicism, but with the horrors of a European war now beamed into our homes on a daily basis, and energy and food prices stretching the resources of many of our homes, the temptation is to turn one's eyes away from the suffering of a wider world, even amongst the most conscientious of world citizens. Events, however, do not stop when we refuse to look at them. Among other merits, debates such as this serve to push back against forces of apathy, and they help us to challenge criticisms of aid as being indulgent, misdirected and ineffective. Crises of drought, famine and conflict are sadly too prevalent across the region of East Africa and the Horn of Africa. The focus I'd like to bring in my comments, Mr Chairman, are on Ethiopia. Significant for its influence in the region as one of the largest, if not the largest in the region, but also because it holds much of the water resource to the region, including the dam at the top of the Blue Nile, the source of the Blue Nile, flowing out into Egypt. But it also holds a unique position amongst its peers, in part through never having been colonised. Alongside parliamentary colleagues, including the Honourable Member for Adrian Schatz, I recently had the privilege of witnessing the excellent work of UNICEF and Ethiopian state and volunteer health workers in the southern region of Borena as they work to fight malnutrition and its accompanying complications. We had discussions with national, regional government officials and politicians, and also with recipients of the aid and relief, mothers with their infants and community elders. And I'd like to just make 3 points, if I may, about the comments that we heard about the aid that was directed towards the country. They spoke of 3 ways. The first they spoke of, and the preferred way, was of bilateral direct aid. In particular, this could be used for capacity building within the country. Their approach to healthcare is community-based. Now, that's partly through circumstance and the challenging terrain that they have, but also the distance and the lack of infrastructure. And I'd just contrast that with our own model of health care and delivery in this country, and to make the point that there is actually something for us to learn from a focus on primary aid and primary health care as being an investment rather than a cost in terms of spending. The other approach they very much take, again partly through circumstance and necessity, is of assuming a degree of personal responsibility. They encourage agency, the education they provide in basic things like hygiene and nutrition, but in terms of taking responsibility, we met with some who use a very simple piece of paper, measuring the circumference of the upper arm of the infant as an indication of the state of the child's nutrition, and then empowering the mothers to act upon that and to seek the aid when it was necessary. The second vehicle of aid they spoke of was multilateral direct aid. And this, for those who are familiar with it, is the model which the Gavi Institute, the Gavi organisation, seeks to use. Again, this allows aid to be directed by the nation itself to where it can build capacity and strengthen systems and that public service infrastructure. The third model of aid that they discussed was implementation aid, which they acknowledged the importance of its palliative relief, but were clear that it fails in leaving any legacy after it's been delivered. And we saw some of the very powerful benefits of that aid, but they were very clear that the principal benefit, both to them as a nation, lies not just in the palliative relief for 5 missed rainy seasons and the consequences of that drought and famine that follow, but specifically the need to build up a robust health infrastructure alongside it. In conclusion, Mr Chairman, I've emphasised the importance of Ethiopia's geopolitical relations with the other members of the region. And I think as a leader in that region and with the resources that it has, a nation like Ethiopia is key to unlocking some of the wider benefits in that region and bringing relief there. Events such as these call us to think bigger, and they drive us to be better. And frankly, I think that bigger and better should also be our response to the questions asked of the UK and its international aid and relief efforts. Thank you, Chairman.